Thank you. Dean Russell.
Thank you, Chair. We're now in the process in the UK of starting to ease lockdown measures, and I just wanted to understand what can be learned from the international experience, where other countries have started to reduce their lockdown, in countries such as Germany and Australia, where that's beginning to happen, and in particular around care homes. Where are they beginning to let visitors back in? What's the process for that, and what can we pick up now that we can implement moving forward to protect people in care homes, but also learn more broadly around the lockdown measures?
Who do you want to answer, Dean? Terry put his hand up. Terry, you go first.
Yeah, if you don't mind. Thank you.
Yeah, actually in Hong Kong, the nursing home started to take away the lockdown on Mother's Day. So Mother's Day is really big, so we need to allow the mother to visit their mother, right? People to visit their mother. So what they did right now is they designate the area in the nursing home as a visitation area, and they allow our family and the resident meet over there. But before they get into the nursing home, they have body temperature check, and they need to follow the strict protocol for hand sanitizer. And then they need to wear face masks, when they are meeting each other. So actually, the nursing home are going back to normal as of today. So since Mother's Day, kind of things get back to normal. But so far, still there is no infection so far, like touch wood. So another one is for the society, the school, high school will resume a class, face-to-face class next week. So this is another big issue coming to Hong Kong. But so far, I think we have very accustomed to wearing face masks. As I say, still, I would say 98% of people in Hong Kong are wearing a face mask. And hand sanitizer is a must, and we have a protocol saying that if you are outside, once you get in, for example, in my family, once I get into my house, I will take off all my clothing, wash my hand, throw away my face mask, and then take a shower before I do anything else. So before I touch my family, before I do anything else. I think it is, as I say, sense of vulnerability. After SARS, we know that if you get infected, it is not only you, it is the whole family, and then the whole extended family. So people are extra sensitive or careful in terms of not bringing in the virus to your home, to your workplace. So I think as long as we keep that kind of attitude, I think Hong Kong should be okay. Another one I want to share is a very transparent and reliable scientific information is extremely important. Even, for example, in Hong Kong, we have several people who lead the fight of the SARS in 2003, and they are still around and they are still active professionally. So they become the figure, the authoritative figure that kind of tell people what to do. And even in some time, their advice are against the government. For example, early on in Hong Kong, the government say you should not wear face masks. But then the medical doctor who lead the fight in SARS, they say you need to wear face masks. So as long as they said you need to wear face masks, everyone wear face masks against the government. So later into mid-March, the government changed the stand and say you need to wear face masks even though you don't have symptoms. So I think right now we have several people who take that authoritative position in the government, but most of them are professors, are medical doctors. So they use scientific information and explain it in a way that most people can understand. So right now, I think that is also extremely important to kind of bring Hong Kong people together, to fight this battle.
Adelina, do you want to come in on that one, on what are the things to look out for when lifting the lockdown?
I wanted to mention that we actually had a webinar yesterday, and there was somebody from Australia who gave a presentation about how they're now starting to relax the restrictions on family visits, in particular in care homes. And she shared some resources, and we will be, so I'm waiting for the final version of the slides and the video from that, but I'd be very happy to share that. So she goes into quite a lot of detail and shared some of the policies that care homes are putting in place to make sure that family visiting in particular become safe. And I'd like to also stress that there's a difference between any visitors and what I'd call family carers, because quite often people in care homes will still be receiving care from relatives who probably visit daily. And it's, of course, hugely disruptive for people in the care home, especially if they have dementia. They don't understand why, for example, their relatives are no longer coming to see them and why they have to see them through the window at best. It's very important to appreciate the huge emotional and well-being cost that this has on people in care homes. And it's very important that we make sure we work to make especially family visits safe. And the same way that we can make staff working in care homes safer, we should also be thinking about how that applies, as Terry illustrated, to family visits.
Okay, can I just ask, perhaps I'll just throw this to Isabell to give a response. Is there a sense, because every country seems to be dealing with this slightly differently, and especially the coming out of lockdown, do you get a sense that globally there is a dialogue and different countries are sharing that best practice, or is everyone trying to go it alone?
I think there's at least a sharing of experience within the EU Commission. So there's like a separate committee in the EU who's reporting who's doing what, and they're keeping, or they are having regular telephone calls and conferences in order to share like who's doing what and when and whether to or how to learn from each other. Globally, I'm not sure whether the WHO is somehow coordinating a form of communication. I haven't joined that kind of meetings yet, but I really like sharing those experiences, like in that session, because this is something we all can learn from. We all do different experiences, and this is very helpful to exchange.
Thank you.
From your perspective, I suppose those learnings are quite public, aren't they? I suppose, would you say that scientists are sort of sharing broadly what they're finding?
Right, this is what they do, yeah.
Thank you.
You're welcome.
Excellent.